Do you need help? The answer to that, asking myself, is yes. We all need help as dentists and humans to survive, to thrive, to not cry on the inside. And today's episode of Talking Nachos is going to share how you can get help for your dental practice for you. Before we get started, I want to share that we are super proud of our Job Connect platform. If you are looking for an associate to share the joy of full contact arts and crafts with you. My associate was there with our practice yesterday. I used Job Connect to get my own awesome associate, the awesome Dr. Alicia. She did a full day of hygiene because one of our hygienists was on the injured reserve, the out for the day list. So if you need help, just text HIRE to 215-543-6454. We will share with you how Dentist Job Connect worked and how we can connect you with an awesome associate. So on Talking Nachos, the entire goal is to help you increase success, decrease stress. We have an awesome show for you today. I'm ready for our first guest. When my team's ready, we have the awesome Dylan Brockman, key resource and sponsor. Now, Dylan, I like you people just to orient the viewers, whether they're watching live or they're watching on demand. What do you do in your daily life to help dentists and humans decrease stress? You might still be on mute there politely, so just let's see.
There we go. Can you hear me now?
Yep, you're good.
Perfect. Yeah. So I appreciate the introduction. And actually, as we were chatting yesterday or earlier today, you kind of mentioned something that I thought was pretty funny. Helping people find health insurance without crying inside. So that's pretty much what I do on a daily basis, right? I'm sure a lot of people understand how expensive and how complicated insurance can be. Kind of going through the process, finding something affordable, finding something that's good enough. And ultimately, that's where I come in, right? So I'm basically health advisor, kind of help people explore all of their different options, whether it's something through the Obamacare marketplace, which are income-driven plans, or something within the private market where those plans are customizable. And some of the best ones could even give you better rates and better coverage based off of medical history. So ultimately, kind of find the different route that's going to be best for someone, for a dentist and whatever stage they're in with their dental practice. Right?
Gotcha.
Whether they're already established, they have multiple locations, or maybe they're just starting up and need someone to grow with them. Pretty much we have a solution for all different kinds of aspects there.
I find that, I've been involved in this process in my own office for the past 2 decades. I'm really proud that, offering health insurance to your team and you is something I believe in, and you really help people, secure a lot of things for their lives. But getting the insurance, figuring out the plans, the different tiers, it really can be so confusing.
Right.
Who are you working with on a daily basis? Are you working with a solo GP? Are you working with groups? Are you working with the office managers? If someone was to text in Brockman to 215-543-6454 and say, you know what, I need to change health insurance plans. I don't even have a plan. My team's going to ask me, tell us a little bit about the process you go through.
Yeah, so basically, I know that usually the head GP or the dentist on staff is pretty busy going back and forth with appointments. Especially this time of year. I know everyone's insurance is getting ready to end, so everyone's kind of getting their last dental cleanings and things like that. So usually it's kind of like an office manager or someone that kind of handles the HR sort of aspect of everything. And pretty much what we do is kind of collect everyone's zip code, birthdays, figure out what kind of medications or what kind of special needs someone needs for their person, right?
What I found is, the dental offices represent really cool teams. And a lot of times you have people ages 19 to 69 working in the same office, which just have dramatically different medical needs. Where do you see offices, if you were just to deliver some education and value, new practice owner, they bought a practice, they're trying to do a bunch of things, their staff saying, I need health insurance, we never had it before. Where do you see dentists go wrong? Sometimes I know my dentist people, they have a tendency to be a little cheap about things, Dylan, but sometimes that cheapness can lead them down a road where things become more expensive. So where do you see they go wrong?
Yeah, so oftentimes, it kind of goes back to this cliche of you get what you pay for kind of thing. At the same time, health insurance doesn't have to be expensive. So some of the pitfalls that most business owners, solo practitioners and things like that fall into is looking for the affordable option, right? And usually those affordable options can be programs that are not regulated by the Department of Insurance. They're not there's no governing body to basically say, hey, you have to pay this medical claim for this
Right.
individual. Usually programs that are kind of like health sharing programs where, the individuals of a plan will share money into a pool of funds, and then they all, help pay for each other's medical expenses, right? Those plans are usually pretty affordable, but when it comes down to actually paying for medical claims, sometimes people could fall into situations where their claims aren't paid, or their claims aren't paid in the amount that they expect it to, right? So although you're saving money on the front end, on the back end, you have a lot of out-of-pocket expenses. And not sure if you knew this, but basically, I think it's like 92% of bankruptcies in America is from medical debt.
I did not know that. Yeah. And I think it's just an opportunity for practice owners to be good leaders and help their team understand, what's possible. I know in our offices, we've always had menu options for our team where, people can pick, I know these were some of the names back in the day: gold, silver, bronze,
Yep.
high, medium, low. And when you give them those options, people don't argue with their own decisions. A great leadership tip from one of my coaches, Carol Kivler. But it's just such a Nacho nuts time on earth, and we see that life happens, and not being protected with the right medical or health insurance, like you said, could just be a total disaster. So I appreciate you sharing this, Dylan. If someone wanted to reach out to you, I know we have our text code, but how could they reach out to you directly if they want a JFO, just find out how you can help them in their office?
Yeah, so I actually have a pretty comprehensive website with a little tab on there that says Insurance Survival Guide. Basically, if you go on www.brockmanhealth, so my last name, health, like healthy, but without the Y. So www.brockmanhealth.com. You can browse on there. You can click get a free quote button. You can schedule an appointment where you can have a one-on-one conversation with me completely free. Or if you just want some information, use that insurance survival guide on there, and you can educate yourself. We have some fun quizzes, so that way you can maybe take a quiz and find out what kind of insurance plan would be best for you and your situation.
I love that. So the ultimate JFO, just find out website. Well, I know you'll be back sharing with us, Dylan. Thanks so much. Really appreciate what you do, being a sponsor. I think, the topping that you offer is so important. It's one that can be easily confusing and complex. So you're here to de-stressify it for all of us.
Yep. Helping you find health insurance without crying inside.
That should be your tagline. Thanks, Dylan. Have a great day.
Thank you. Have a good one.
So as you can see on Talking Nachos, our goal is to decrease your stress, make things better for everyone in your office.